Sex and gender differences in Alzheimer's disease became the primary focus of the work done at the Women's Brain Project. And it started with a very simple question. Is there anything beyond prevalence? We know that 80% of the patients with Alzheimer's disease are female, but the question we had is, are there any other differences in this regard? And we learned that, yes, indeed, that's the case. We have that women progress much faster with the disease than men will do. We have learned that women might have more brain atrophy as compared to the male population. We learned that even biomarkers, for example, tau, might have a higher deposition in the female brain versus the male one per same stage of disease. And what we also know is that women do have they tend to be overlooked in terms of diagnosis because the mild cognitive impairment phase, which is the beginning of the disease, often get masked by the fact that women are very skilled in verbal output. And the scales that are used at the moment to measure mild cognitive impairment are highly based on verbal assessment, which means women masks. And so the doctor can depict the real picture of what is going on with the brain of a woman versus the one of a man. Additionally, there is also the natural bias within medicine that doesn't really take women that seriously. So a woman might be told, oh, this is stress, this is problems you might have with your family or your work, and come back in 6 months. This is a problem that it is embedded within the entire medical indications and spectrum. So even Alzheimer, it is interested. We also did a patient journey survey at the Women's Brain Project, where we interviewed many patients between US and Germany, above 100. And what we learn is that indeed those differences, even in the diagnostic journey, are profound. One element that we need to consider is also that where women might differ than men, it's the symptomatic of the disease. Often the women come to the observation of a doctor with symptoms related to depression, because the first phase of the disease might be really more on the depressive spectrum of things rather than the cognitive dysfunctions, or, as we said, women mask given to the high verbal output. So depression, it is often the first symptom addressed, treated, and what we learn by the patient in the patient surveys that women, as compared to men, within the whole duration of the disease, will have antidepressant treatment, which is also a significant information to take into account. To make the story short, why does it matter? Because if those sex and gender differences do exist, like in the case of Alzheimer, but many other diseases, we need to take into account for those when we do preclinical research, clinical development, and when we try to characterize our patients adhere to a given treatment and how to optimize that patient journey, the diagnostic of the patients. So actually, it's a transformation. We could literally transform the way we do medicine by taking those sex and gender characteristics into account. And it's valid for women and it's valid for men, for the male population.